Good morning and welcome to News at 10, reaching you live on the network service of the NTA. I am Muslima Sholebo.
And I am Norlin Ebel Ame. Many thanks for joining us. Let's begin the news with a quick look at the headlines.
Citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period.
Federal government orders lockdown of Abuja, Lagos and Ogun states as coronavirus cases rises to 111.
Political group go on house-to-house sensitization and donation of safety kits on the pandemic within Abuja metropolis.
African Center of Excellence for Genomics of Infectious Diseases in Osun works round the clock to test samples for COVID-19 from across the country.
Plus, religious leaders in Taraba State campaign against COVID-19 across the rural communities in the state.
Even as the federal government explores all avenues to contain the coronavirus pandemic, the National Center for Disease Control, NCDC, as at 9:30 p.m. on Sunday, the 29th of March, confirmed 14 new cases of COVID-19, bringing the total number of cases in Nigeria to 111. Of the 14 cases, 9 are in Lagos, while 5 are in the FCT. This number raises the number of cases in Lagos to 68 cases and 21 in the Federal Capital Territory.
The federal government has directed the cessation of all movements in Lagos and Abuja, the nation's capital, for an initial period of 14 days.
The lockdown, which also affects Ogun State due to its proximity to Lagos, begins at 11 p.m. on Monday, the 30th of March.
President Muhammadu Buhari, who gave the directive in a nationwide broadcast, said the measure is aimed at containing the spread of coronavirus pandemic in the country. State House correspondent Adamu Sambo has the details.
The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis.
As a nation, President Muhammadu Buhari said Nigeria's response to COVID-19 must be guided, systematic and professional. And in doing so, he emphasized there is no such thing as overreaction or underreaction, rather the right reaction by critical institutions of government and experts. He said with Lagos and the FCT having the highest number of confirmed cases of coronavirus, cessation of all movements is imperative.
All citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states.
The restriction order, he said, does not apply to institutions and individuals on essential services. President Buhari explained that the federal government is fully aware that such measures will cause hardship and inconveniences to many citizens. He was, however, quick to add that with the dreadful situation in other parts of the world, this is a matter of life and death.
We must all see this as our national and patriotic duty to control and contain the spread of this virus. I will therefore ask all of us affected by this order to put aside our personal comfort to safeguard ourselves and fellow human beings. This common enemy can only be controlled if we all come together and obey scientific and medical advice.
President Buhari announced various palliative measures to ease the pains of those whose livelihoods will be affected by the restrictive measures in the coming weeks, while directing the Ministry of Humanitarian Affairs to develop strategies towards sustaining the school feeding program during this period. The president also ordered the immediate implementation of a 3-month repayment moratorium for all trader money, market money, and farmer money loans.
I have also directed that a similar moratorium be given to all federal government-funded loans issued by the Bank of Industry, Bank of Agriculture, and the Nigerian Export-Import Bank. For the most vulnerable in our society, I have directed that the conditional cash transfers for the next 2 months be paid immediately. Our internally displaced persons will also receive 2 months of food rations in the coming weeks. We also call on all Nigerians to take personal responsibility to support those who are vulnerable within their communities, helping them with whatever they may need.
The federal government, he said, is committed to doing whatever it takes towards confronting COVID-19.
I want to assure you all that government ministries, departments and agencies with a role to play in the outbreak response are working hard to bring this virus under control.
President Muhammadu Buhari thanked all healthcare workers and other essential staff on the front lines of the response against the global pandemic for their dedication and commitment, describing them as true heroes. From the State House, Adamu Sambu, NTA News.
And live in the studio with us to analyze the president's address to the nation last night on COVID-19 is Dr. Abdulrahman Abu Hamisu, a public affairs analyst. Thank you so much for joining us on the News at 10.
Thank you for having me.
Now, what do you make of the presidential address on the COVID-19 pandemic?
Well, one of the things I noticed in the speech of Mr. President is the measured and studious approach to all of the issues. It shows that government is on top of the situation and government has been studying the situation as the pandemic progresses. And that ensures the kind of palliative and decision that Mr. President was able to bring to bear on the entire process. One is the lockdown of Abuja, Lagos, and Ogun State, because the reasons he gave are quite germane. One is the cases are beginning to rise in these two cities. Ogun State is a victim of proximity because of the movement between Lagos and Ogun State. So that is to show that the government is actually watching the situation keenly and taking decisions that will not affect the population in a manner that will lead to further crisis. What do I mean by this? It shows that the government doesn't want to unnecessarily inflict pains on Nigerians to the extent that it is not even the COVID-19 that will kill people, but hunger and a lack of space to move around to look for our daily bread. So it shows that government is reading the situation. The second thing again is the palliative measures. For instance, it talked about moratorium for persons that are indebted to federal government as a result of the programs and policies of government that warrant that people take loan. At this point in time, a lot of state governments are doing a lot to ensure that the pandemic does not spread to their state. For instance, Niger State earlier last week announced curfew. Kano State government, as important as Kano is to the commerce of this country, announced the closure of boundaries between states. Therefore, we are watching a situation whereby if people are going to pay the interest on the principal of the loans they've taken is going to lead to indebtedness because business is not really taking place in Nigeria. Therefore, the government has really shown leadership and then...
All right. Now, how appropriate is the lockdown at this time, even as some Nigerians on social media are saying it should have not been done this way?
Well, the lockdown is very important because it's not as if the virus is moving around. The virus is not moving around. It is people that are carrying the virus around. And the point of contact of the virus ensure that it spread to those that are not really affected. So if it is people that are the host that are carrying around the virus, then it means that for us to contain the virus where it is already established that there are confirmed cases, then it means that there should be lockdown. The people that are talking on social media, it's important that they talk. But what I want them to understand is there are actions that needed to be taken, not because they are popular, but because they are going to save situation. So popular action does not mean that those actions are right. And therefore, if they are talking on social media, they should be able to proffer solutions, not to just criticize.
Now, let's take a look at this. State governments are to nominate doctors and nurses who will be trained by the NCDC and Lagos State government on tactical and operational response to the virus in case it spreads to other states. Now, what do you think the impact will be on such training on the containment of that virus?
We all know that in Nigeria, there is that of capacity at the local and state level, even at the federal level. And this is a new challenge that our experts are learning every day to cope with. So for me, there is no better strategy than what the federal government has done. Nominate experts that can be trained. The people that are going to train them are people that have handled cases, confirmed cases. So it shows that there will be transfer of knowledge preparatory to the to containing untoward situations that may arise. But we are praying that with the lockdown, the virus will not spread to those states. But in the case that will
they be eliminated?
Well, from what we've seen from the state, apart from general assistances, so if there is need for enforcement, there should be enforcement so that there will be general trend towards containing the pandemic.
Now, one last question. Let's take a look at this. On the issue of testing, there are a lot of Nigerians who seem to be eager to get tested, but don't know how or where to get tested. Now, do you know if there are any test centers open to the public where Nigerians can walk into and get tested?
Well, most of the test centers and the test result we've really received so far are for categories of persons. One, highly exposed persons that have come into contact with high-profile individuals in the society, as well as those that are of the that are not high-profile individuals, but they've come in contact with these confirmed cases. So there is, though the NCDC had said they have centers where people can test, but citizens are confirming that they are not tested, that the test kit is deployed to testing only high-profile individuals or those that have come in contact with confirmed cases, which means that those that have not shown symptoms, those at the lower rung of the ladder in the society have not been captured in terms of testing for coronavirus. So I think one of the challenges we needed to take care of as we move into the second phase in the lockdown is to ensure that test kits are made available to those states that there are confirmed cases so that as many persons as possible can be tested so that we are sure that the numbers we are having now are not numbers that are coming from the restricted nature of the testing, that it is a true reflection of the fact that many people are not really they've not been infested by the virus.
Okay, we hope so. We've been speaking with Dr. Abdurrahman Abu Hamisu, Public Affairs Analyst. Thank you for your thought on the news at 10.
It's my pleasure.
And you're still watching the news at 10 on NTA News 24, reaching you live on the network service of the NTA. When we return...
Ekiti State government imposes dusk to dawn curfew to curb the spread of coronavirus. More details after this break.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
Meanwhile, the Nigeria Center for Disease Control, NCDC, says it is working hard to expand its testing capacity for COVID-19. On clarification of number of laboratories, NCDC says there are currently 6 laboratories in Nigeria with capacity to test for COVID-19, assuring Nigerians of plans to scale up to 13 labs in the next 3 weeks. Meanwhile, Imo State Commissioner for Information and Strategy, Declan Emelumba, debunks rumor of COVID-19 related death in a hotel in Owerri, says there is no confirmed case of coronavirus in Imo State.
As more cases of coronavirus disease have been reported, the African Center of Excellence for Genetics of Infectious Diseases, Ede Osun State, is working round the clock to test samples for COVID-19 from across the country. Correspondent Shegun Lawale, just back from the center, reports.
In the last 3 weeks, the African Center of Excellence for Genomics of Infectious Diseases has received not less than 70 samples of COVID-19 for diagnosis from the reported cases in Nigeria. The multi-million-dollar testing center, which is the only facility in West Africa with first-class equipment, is able to understand, apart from diagnosis, the structure of COVID-19, as well as also used to confirm Ebola outbreak in 2014 in Nigeria.
These machines help sequence the first coronavirus in Africa, and that was from the first Nigerian patient, or the first patient in Nigeria, and we did that in 48 hours. And just the only reason why we could do it in 48 hours because we have the skills, we have the technologies, we have the know-how to do this. We did that so quickly. China couldn't do it, Europe couldn't do it, even the US couldn't do it. At least we demonstrated to the world that we could actually just sequence the whole virus in 48 hours. And that becomes very important because understanding, the genetic nature of the virus enables you to see what the virus looks like. It enables you to understand, how the virus is transmitted from one person to the other. It also gives you an idea over time to see if the virus is mutating. If the virus is becoming more infectious, then at least with that, we can develop the right type of countermeasures. And the kind of countermeasures that we're talking about are developing new diagnostics, new therapies, and then new vaccines.
Apart from the index case, which was confirmed positive by the center after it was detected in Lagos, a number of other samples have also been confirmed positive at the center at Ede.
So most of the cases are negative, but at least I would say that the very first case that we received, that was the first case in Nigeria. We were able to, not only reconfirm that, but we used that as a way to display, the firepower behind the technology that we have here.
So even if we keep having samples coming in 10s, 20s, we are set for it.
In the meantime, following the confirmed case in Osun, government has closed down all major markets and put a limit on the boarding capacity of commercial transportation, including motorcycles, to contain the spread of the virus.
We are quite aware of how serious this is, and the governor has said that we will treat it with all the seriousness that it requires.
The ban on congregational prayers is also being enforced across Osun State. Shagulawale, NTA News.
Still on the COVID-19 pandemic, the increasing number of cases of the coronavirus in Nigeria has been observed to be a time to work hand in hand with various organs of government in stemming the spread of the global pandemic.
A group known as Grassroots Mobilizers for Buhari and Osinbajo was of the view, while carrying a house-to-house and street-to-street sensitization and donation of safety kits on the pandemic within Abuja metropolis. Timothy Yusuf reports.
With this cab driver asking if the hand sanitizer is to be consumed, largely shows that even in the face of the ravaging COVID-19 pandemic, quite a lot of Nigerians are still unaware of its presence and danger it poses. It is for the likes of the cab driver that this political group embarked on the sensitization.
I was surprised because I never knew that this kind of thing is going on here. So we're just passing by.
It's something that is causing a whole lot of panic in everybody's heart.
But saying this one now, if we want banner for banners now, 500 naira each one.
Organizers of this gesture believe that it is time for citizens to remain their brother's keeper.
Well, we have to do it because our grassroots, they need sanitizer because they didn't even know what is coronavirus. So we have to come out and do the awareness. It's not a death sentence. So if you have it, if you have fever or anything, just run to the nearest hospital.
Government alone cannot handle such situations. There is need for, citizen partnership, citizens' involvement and inclusion. And this is what we are doing.
They commended the efforts of government and the organized private sector and some individuals who have contributed resources to the collective effort against COVID-19 pandemic. Timothy Yusuf, NTA News.
In the meantime, the Chief of Staff to President Muhammadu Buhari, Abba Kyari, has revealed he will be going to Lagos for additional tests and observation after testing positive for coronavirus. In a statement, Abba Kyari says he has followed all the protocols of self-isolation and quarantine. He adds that he has not experienced any high fever or other symptoms associated with this new virus and has been working from home. Kyari further reiterated his commitment towards serving the president and people of Nigeria. He assures all that President Muhammadu Buhari will do whatever it takes to protect the health and safety of Nigerians to get the country back on its feet as soon as possible.
The Comptroller General of Nigeria Immigration Service, Muhammad Babandede, has tested positive to COVID-19. A statement by the Nigeria Immigration Services PRO indicates that the CGI returned from an official trip to the United Kingdom and promptly went into self-isolation and requested to be tested in line with the advisory of health authorities. The result of the test came out positive in spite of his stable condition. The Comptroller General is, however, active and directing affairs of the service online, while the Deputy Comptroller General overseeing administration keeps service activities running within this period to deliver on its mandate.
And in the meantime, Ekiti State government has imposed a dawn-to-dusk curfew on the state to curb the spread of the coronavirus COVID-19.
Governor Kayode Fayemi in a broadcast also announced total lockdown at the state borders during the 14 days curfew. Ayodeji Ogunshaki reports that residents of the state received this with mixed feelings.
Ekiti State having recorded an index case of COVID-19, government has taken steps to curtail further spread. In the broadcast tagged, "We must do more to prevent outbreak in the Ekiti State," the governor noted that the various measures taken so far to prevent community transmission of the disease be consolidated for the safety of all.
We cannot afford a public health crisis. This is in order to prevent the spread of coronavirus in Ekiti State.
The governor, who asked for full cooperation from people, noted that any person who contravenes those regulations shall be liable to a fine or to imprisonment for a period not exceeding 6 months or both. Meanwhile, the imposition of the curfew has generated mixed reactions from members of the public.
We need to cooperate with the government in making the policy being effective. But for the self-employed people, the government should have a way of assisting.
Government tries to save us, so what government do is a good thing.
The 14 days coffee is expected to last till Monday, April 13, 2020. From Ado-Ekiti, Ayodeji Ogunshakin, NTA News.
And you're still watching the news at 10 on NTA News 24, reaching you live from Abuja. Still to come.
Kano State Government constitutes fundraising committee to provide succor to vulnerable members of the society. Details of this and more when we return.
COVID-19 has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.